Hi everyone, so today I'm going to teach you how to do the Rocabado 6x6 exercises. These are great for TMJ issues, and as many of you might know, TMJ issues often coincide with neck pain and or headaches. So these are 6 exercises and I'm going to talk you through them and show you them each one by one. So the first one is to simply learn how to put your tongue in what's called the resting position of the mouth. So you're going to put your tongue right behind your teeth on the roof of the mouth, and everything else is relaxed. So the mouth is closed, the lips are closed, but the jaw is completely relaxed. And you're going to breathe for 6 breaths. And as you breathe for the 6 breaths, you might notice that you're clenching, but you want to try and keep everything soft. So that's exercise number 1. Exercise number 2, you're going to keep that same resting position, but now you're going to open and close the mouth 6 times. So again, right here. Okay. And you want to try and do the open and close in a complete straight line. Some of our jaws like to do an S or a C curve, and it can be really helpful to just look in a mirror while you do this and try to keep that line straight. You might not be able to correct it, but sometimes just having that visual feedback of looking in the mirror does do the trick. So resting position and then open the mouth 6 times is exercise number 2. Exercise number 3 is now you're going to provide some gentle pressure. It's called an isometric. So we're going to do 3 different directions. The first is going to be on the side of the jaw. So just take 2 fingers, press on the side of the jaw, and your tongue's in that resting position again. And what you're doing is you're pushing gently as though you were going to push the jaw to the side. And you're going to push and hold for 6 seconds. And then relax for 6 seconds. Okay, and then you'll switch. Same exact thing, but now the other way. 6-second hold, 6-second rest, and then lastly, you're going to put your 2 fingers under the chin, and you're going to open and close while the tongue is in that resting position 6 times. Okay, that's exercise number 3. Exercise number 4, you're going to put your hands on the back of the neck, so right in the back. And the pinky side edge of your hand is going to act like a shelf right at the occiput, the base of the skull, okay? So you're just kind of resting here. You're not squeezing really, you're just kind of passively resting here. And then you're going to do a gentle nod and pull up. Now we don't want the hands to slide up on the head. It's just a gentle lift. And you might even feel a stretch in the back of the neck. And close your eyes, tongue is in that resting position, and you're going to breathe for 6 breaths. That's exercise number 4. Exercise number 5 is just a simple chin tuck. So what you're doing here is you're bringing your chin towards your Adam's apple, and you're not opening and closing the mouth. The jaw is staying where it is. In fact, the tongue is in that resting position again. And it's like you're trying to give yourself a double chin on purpose. You're not dropping the head. Some people even feel a stretch in the back of the neck and the head with this one as well. You'll hold that for 6 seconds. And then lastly, we're going to do something called scapular retraction. And this is where you squeeze the shoulder blades together. Something to look out for here is we're not going up and back. We're only going straight back. And you can either do 6 repetitions here, keeping that tongue in the resting position, or you can choose to go back and hold for 6 breaths and then relax for 6 breaths. Okay, so those are 6 exercises. They're called the Rocabado 6x6, named by the person who created them, for the TMJ, headache, or the neck pain. And some people recommend that you do them 6 times per day. I know that can be a little bit tricky for some folks, so just start by trying to do 1 set and see how you feel. And most of the time I recommend this to my patients on an as-needed basis so that they can learn to self-manage their pain. Let me know what you think. Thank you.